What's going on, guys? Welcome to my new channel about hair transplants. Super excited to be doing this. One thing I do want to tell you about this channel is this will be the realest, most intense channel as far as hair transplants go. I want this to be super behind the scenes. You're going to be going along the road with me the entire way. This journey's going to be crazy. I've never done anything like this, obviously. I don't know anyone that has. I looked up a few videos. Some people have done some cool stuff. Most of it's like flashback series of like, oh, here's my last year. But I wanted to do a series that was super genuine and talks about, each month where I'm at, whether things are itchy, whether they hurt, whether there's redness, whether there's discomfort, how am I feeling at that point? Because a lot of people go through the ugly duckling phase, which is month 1 through 3, where all your implanted hair falls out. Now, emotionally here, that is the hardest time to actually show and to be going through. But I'm excited about the whole thing. Now, as far as schedule goes, I will be doing a monthly video, but today is July 3rd, it's my birthday, and I will be filming again July 10th during the surgery and showing that in this video, showing them doing the cutting, all the transplanting, everything, okay? I am doing FUE, but as far as upload schedule goes, before I continue the video, I will be saying this. I'll probably upload the 11th or the 12th, depending on how I feel. Obviously, it is a surgery, and you get pretty drugged up for it. But then I will be doing the first and third Friday of each month following, which works out perfectly because that means I'll have the 30 days exactly on the head for August 7th. So I'll film that day and post it. And then basically each month from there, each first Friday, I should say, of each month from there on, I will be doing a 1-month update showing the hair and talking about the process. In between that, the third Friday of each month, I will be doing videos on, different things, talking to doctors whether FUE or FUT is better for you guys. I chose FUE, and I'll explain why in a different video. But it's just really a choice, honestly. There's so many pros and cons to each of them. And actually, there's very few, there's few cons. But, obviously, it's a surgery, so there are risks. But let me show you my hair real quick. Obviously, I have it, pushed aside, but let me just try and get it as clear as possible for you guys. I'll pull all the, strong hair from the sides out of the way. Try and give you a realistic image of what it looks like. Hopefully that'll help you get a clear view. I want this to be as realistic and honest as possible. So yeah, as you can see, it's pretty wispy in the way that there's no way, I could do anything style-wise, put my hair up. You're never going to be able to do that. Which is why, I kind of want to get the surgery done. Obviously, I'm stuck in quarantine. It is 2020, and things are kind of crappy right now. So I wanted something positive for myself, and I felt like this was a cool way to do it. Obviously, most of the time, I do just brush my hair to the side, and yeah, obviously, it looks better than normally, but you get the idea. It's usually just to create an illusion I still have my hairline, and that's all I really can do with it, unless I was to shave it all off. There's nowhere for me to really put it. Some people are like, why don't you do something? There's really nothing I can do. What are you going to do? Put it forward? I'm sure you guys get it. You're watching this video. Not many people watch this video are going to have a full head of hair and oh, I've got no worries, unless you're a messed up person. I'm kidding. But hopefully this is entertaining, and I do want this to be a learning experience for us all. I've done a ton of research. I have tried things in the past, like laser helmets and stuff like that, and I have seen results, and I will be discussing those later. Because I've also seen the bad side of different things, whether it's, medications or pills or Rogaine or whatever it is. But as I said, every 2 weeks I will be doing a video, or I should say every 4 weeks I'll be doing a video on my actual update of my experience. But in between those, every 2 weeks I will be doing, reviews on products like Hims, Keeps, laser helmets, caps, whatever it is. And I'll be partnering up with a ton of different doctors to go ahead and make sure that I have the most up-to-date knowledge on each of these things. I will be talking to each of the companies, checking reviews, and of course telling you my own experiences along with other people's. I have found somebody else that has a really cool hair transplant story, so I definitely recommend you stay tuned for that. But that will be a few months out, so a bit of a cliffhanger there. Sorry, guys. But in the meantime, let's go ahead and skip directly to me walking into surgery in a few days from now. And obviously it's about a week, but I am excited. I'm nervous. I'm very nervous. I'm not going to lie. It could be a huge mistake, but it could also be the coolest, most amazing thing I've ever done. And I think it will be. I did a lot of research on Dr. Panine, and that's what we'll be going to. He is in Chicago, and I will be leaving all of his info below so you can check him out. But yeah, really excited, guys. Stay tuned. 2 seconds. Here we are at surgery day, guys, and Dr. Panine is taking his time drawing up the final hairline for me, adding a little widow's peak, and you're going to see all the details here. I just zoomed this part up because it was a little longer than necessary, but enjoy. So when do you typically do your first haircut?
Well, you know, it depends how you heal, but usually at least a couple of weeks.
Okay.
But better a month. You know, let everything sort of settle down.
Sure.
You know, I think this is what we should do. And that pretty much reconstituted what we did over there.
Yeah.
Just did a little bit of a tiny bit, a little bit of a widow's peak, which is actually a youthful trait.
Okay.
So, you know, too rounded, it's a little bit more mature.
Okay.
Yeah.
Look good?
Yeah, that's great.
Yeah, absolutely.
All right. We're ready to rock and roll here.
Ready? Let's do it.
Very good donor area. Nice. Good. And you will feel it cold, and then a little vibration. That's from a little massager.
Cool.
And then a
Free
little
massages are nice.
pinch. Little pinch, yeah. It can be like a little
Check the shit out of me. I was
little
like,
massager like this.
Yeah.
And then
Start the nice.
and then a little pinch, and that's the only thing you're gonna really feel, because then we just go from numb area outward, and that's will be.
I heard this is the painful part of the procedure.
Yeah, that's the worst part. And after that, it's all pretty much not as bad, because people realize that it's not gonna be that painful, because scalp doesn't have a lot of nerve endings, so it is pretty comfortable overall. So we'll do a little cold. We'll do a little cold again. And then this little massager.
What's that do?
What it does, it distracts you from feeling. It's a gate theory of physiology, when the nerve impulses are transmitted by the same nerve, C4 nerve fibers, and basically compete for transmission. So when you vibrate and check at the same time, it doesn't hurt much.
So it's
Like
little
two
pinches
things.
is all I'm gonna feel?
Well, that's right. That's exactly right.
What the fuck, you're doing it right now?
That's it. We're done. You can go home.
I'm sorry.
Just joke.
That is so funny.
That's
I should have recorded myself on that. That's hilarious.
That's just little anesthetic, and then this area gets numb, and then basically
This is what people are complaining about.
Well, yeah. I'm just telling you, the tattoos are way worse than this. Okay. What do you feel? You feel any pressure? No pain, good. Well, if you feel any pain, please tell me right away, because when you feel pain, you tend to bleed a little bit more, and then it takes longer to do it. So if you don't feel it, it helps. Yeah, don't immediately. Yeah, because it helps me and it helps you when you know that it's uncomfortable. We can jump on it.
Oh, Stuart, we should do a conversation before Chief RN, talking about size of punches being used.
Yeah. Doc, what size punch are you using right now?
0.75.
0.75 punch? Okay.
Right.
And how do you choose which size punch you use? Based on type of hair?
Well, it's based on the diameter of the hair, based on the hair quality. And also, it depends on if the hair is wavy, then there's a little bit more of a curl to the, or a little bit of a bend to the hair follicle, and you want slightly bigger punch so that you have less chance of transecting the follicle. Or if it's a
It was a little hard to hear Dr. Panine in this part as he was very focused on the surgery. I will be doing a video in the future talking about the size of the hole punch that should be used on your hair. Obviously, a lot of doctors will tell you the smaller the better, but Dr. Panine was explaining that that's not always the case. It depends on the type of hair you have, how big the follicles are, etc. We'll go over that in a further video though. But in this little segment you're seeing here, you can see him putting more lidocaine in me and also removing hair follicles both by the punch and then using the tweezers or whatever to remove those hair follicles. But I zoomed it forward because it's kind of a quiet moment, so just want to show you a little behind the scenes, and here we go.
How about use this body for this?
Nope.
Good.
You don't feel anything, do you?
Nope.
Good.
Excellent.
So we're done with phase 1 of the procedure. How are you feeling right now?
Right now I'm feeling pretty good.
Hungry?
Actually not as hungry as I thought I'd be, but they want me to eat plenty, so I got energy.
Good.
But other than that, went really smoothly. Barely felt anything. There's like a couple times where I started feeling pinches again, and then they just
He gives
put
you a
a
little
needle
more
in,
anesthesia and
it's
you're
gone.
fine. Yeah.
So yeah.
So what we're going to do
Minor
now,
discomfort at best.
what we're going to do now is he's going to go into the second step right now where he's going to start making surgical sites once you're done with your lunch, and you shouldn't feel anything when we do that either, and then we get to put them in.
That's
So
exciting.
enjoy your lunch there.
I will. Thank you.
But let Dr. Panine just check everything out here, Brian, and
Yeah, looks.
make sure everything looks
fantastic.
good.
Looks fantastic. Looks very good.
We got a little more than we were expecting to get done today, which is great.
Yeah, absolutely.
Very great.
How's the donor area?
How's your pain though, Brian? You have any pain at all or minimal?
I honestly felt almost nothing.
The whole
entire-
time? Really?
Yeah, numb.
Good.
It was great.
Fantastic.
Good.
I was
good
very
result.
surprised.
We're
Also,
done.
everyone over-exaggerated those needles' pain. They were so easy.
No, yeah.
They were not bad at all.
It looks excellent. Everything looks good. We're just gonna put a bandage on you now.
If you look
And
at the
then-
back, I didn't only got a quick look at it, but basically
We got
I
a bunch
was-
of pictures and everything of that too.
I'm just saying for the video, I was super surprised at
Mhm.
how small an area you guys were able to take from. Meaning I left a lot of donor area untouched.
Oh, you got plenty of donor area left.
Awesome. It's awesome.
Tons.
Occasionally,
All right.
Very good news.
The crown area, yeah.
I'm very thrilled.
Thanks.
Yeah.
Where has, oh, okay. That's something.
I feel good.
I think we should start doing this every phase.
Why not?
Why?
Oh, that's full service.
Perfect timing. Your ride should be here, and
Yeah. Guys, so I cut the footage there at the hospital, or the doctor's office, I should say, but I wanted to go ahead and finish the video off with a little outro. I want to show you what the hair looks like on day 3. This is what it looks like. It's looking really good. The redness, the purpleness starting to go away already. But 3,000 follicles are in there, and there's going to be tons of update photos and videos. You're probably wondering what this is. This is just the fluid drainage and bruising from up there coming down my face finally. That's common on day 2 through 6. And so day 3, here we are. I will show you the back of my head. It's really amazing, guys. How it healed is so crazy. I mean, just to think that like these were open holes like 72 hours ago, and now they are already starting to disappear. I would say within a week, they should be already barely visible at all. My friends are completely blown away. Obviously, Dr. Panine did a phenomenal job, and I am super excited to see the outcome of this over the next few weeks and months. And obviously, I'll be doing videos every month, as I said. So make sure you subscribe and follow me on Instagram. My Instagram is Hair Transplant Reality. It's going to be on screen. So do that, and I'll be posting tons of photos. I will be doing videos on how to properly wash your hair and, just a ton of different things like that to have, better results with your surgery. Just so you know, guys, I did actually go from 2,500 up to 3,000 FUE on this transplant. So that was actually really exciting to be able to get an extra 500 in there. So big shout out to Dr. Panine for being able to do that and allowing me to get film inside the procedure room because it's not really a normal thing. So being able to film the procedure and, his openness to allow me to do this has been really great. I will leave all the info for Dr. Panine Chicago Hair Transplant Clinic in the description below. If you have any questions, you can reach out to him. You can call him directly. You can ask me questions in the comments. I'll do the best I can. I'm not a doctor, but I'm doing tons and tons of research and talking to tons of them. And Dr. Panine is the best. He's amazing. So I highly recommend, even if you are curious about a hair transplant, he will give you a blunt answer. And Stuart also is amazing. So give them a call. Their number's below if you have anything that you want to ask them or get your head checked out, see if you have the right grafts for a hair transplant. But yeah, guys, thanks so much for watching, and I'll see you guys in a week and a half. Cheers.